Wyoming Senator, Republican John Barrasso, chairman of the Senate Republican Policy Committee, also a doctor, and it's great to have you back with us, especially in person here in New York. She says we didn't do it behind closed doors. Republicans should not do the same. Let's address that in a moment. But first, this whole theme about unity in Congress. Is there an opportunity, or is it too temporary for that?
Well, I think there is an opportunity, in a bipartisan way. We passed a sanctions bill last week against Iran, against Russia, and unifying our position also in support of NATO and our NATO alliance. And that passed 98-2. Rand Paul voted against it. Bernie Sanders voted against it. But that is a significant bipartisan vote to say we're going to focus certainly on American security, and our sanctions against Iran and Russia are a critical part of that.
So that answer suggests that there's an opportunity here. But knowing where these two sides are in health care, is that truly realistic?
Well, I want to work with people on both sides of the aisle on this. Amy Klobuchar and I work closely together. We've discussed health care. But you've got to take a look at the fact that the pain of Obamacare is getting worse. The insurance markets are collapsing. For many people around the country, can't buy insurance from anyone because there's no one willing to sell in so many counties across the country. On the other hand, the Democrats in California, the state Senate has passed a basically single-payer plan. The cost $400 billion, which is over twice the entire general fund of the state of California. So that is not realistic where the left of the Democrat Party is trying to lead things.
And I know you're not going to go that way, but Mitch McConnell over the weekend indicated that he has a July 4th deadline to get things through the Senate. That's less than 2 weeks. Will that happen?
I believe we're going to vote before the 4th of July recess on a health care plan, a repeal and replacement of Obamacare. Every Republican is trying to get to yes. There are some differences of opinion on specific details of this, but you may have seen Chuck Schumer, the Democrat leader, sent a letter to Mitch McConnell on Friday afternoon saying, let's get together, because he admits now that Obamacare is not providing affordable or accessible coverage or care. And as a doctor, I focus on the word care much more than I do the word coverage.
We saw what happened in Ohio, and as you mentioned, 20 counties not having coverage, et cetera. Marco Rubio, your colleague, put it this way right now when it comes to the calendar and deadlines coming up fast.
That's got to work its way through a committee. It's got to work its way through floor action. Every senator will have a right to offer amendments to change the law and have input that way. So this is part of a process. This is just the first step in the process.
Sounds like a lot.
There's a lot to be done.
What, 10 working days, I believe it is?
There's a lot to be done. I'm confident and committed to getting this to the floor, and I'm working hard to make sure we get the votes to pass it. You need at least 50 with the vice president breaking the tie. But if you take a step back and say, why are we doing this? It's because premiums have exploded, doubled in the last 4 years. Choices have gotten less, but we're focused on protecting people with pre-existing conditions. My wife, Bobby, is a breast cancer survivor. As a doctor and a husband, I know how important it is for people with pre-existing conditions. And Medicaid, long-term, we have to stabilize that and strengthen it so that it can continue. And I always felt when I was in the state Senate in Wyoming that the best way we could do that is if the states had the opportunity to get that money and make the right decisions. We could have covered and helped many more people at home if we didn't have the one-size-fits-all coming out of Washington.
You said a lot there. You said you'll get a vote on it. I don't know if it'll pass, but you're predicting passage as well. So let's see. That's a high hurdle.
I'm focused on passing.
You have 3 Republican senators who are on the fence about a lot of this stuff. What is it? Rand Paul, it's Mike Lee, it's Ted Cruz. We will watch them as they move through it. And also watch the president. When he said the House bill is mean, what does that do to your negotiations?
Well, I think what the president was saying to us is we're happy the Senate is writing a bill of their own. Make it in a way that we can help people get the care they need from a doctor they choose at lower costs. And we're working closely with him. We had 15 Republican senators with him at the White House. Vice President Pence has been to so many of our Committee of the Whole meetings. He comes every week to our policy lunch, is very actively involved in the process. So, and he as a governor did such a great job with Medicaid.
Understood.
States have to have the flexibility
I'm out
to do
of time,
it.
but the Democratic senator that we let in with said you're doing this not in public view. What do you say to that charge?
Under reconciliation, the process we're using, every senator is going to be allowed to offer amendments on the floor of the Senate. Every member, Republican and Democrat, is going to be a wide open process. So when they read it, they take a look. If they don't like it, they can bring an amendment and try to change it in a way that shifts it one way or the other. I'm focused on trying to get it done.
The clock is running, as you well know.
Thanks.
Senator, thank you very much for your time here.